Hi, so today I'm going to be talking about preterm labor, signs, symptoms, what preterm labor is, and some ways to hopefully prevent preterm labor. So first of all, just to define what preterm labor is when someone goes into labor anytime after 20 weeks, but before anytime between 20 weeks and 36 weeks and 6 days. So once you're to 37 weeks, that's more like early term, but you're still close to term. And then anything beyond 39 weeks is considered full term. So it's the time between 20 weeks and 36 and 6. That is when it can be a little bit more compromising for the baby. Obviously, we know that typically babies around 20 weeks are not going to survive unless you're in, I don't know what the earliest preterm baby was, but this is kind of, you need extreme medical care for babies born within those ranges. It's really important early on in the pregnancy to get good dates on the pregnancy. So a lot of people just go by the first day of the menstrual cycle, and that can be pretty accurate. But where I work, we like to do a first trimester ultrasound if the client is open to that. And the reason we like to get the first trimester ultrasound is because the margin of error for the discrepancy in the size of the fetus is pretty slim. It's a lot smaller. So we really like to get that first trimester ultrasound and compare that to the last menstrual period, and we come up with a due date based off of that. It's really important to get good dates because birthing outside of the hospital, you want to make sure that the baby is going to is most likely not going to need any kind of intervention with breathing and things like that. And then also post dates, which this is about sorry, I just blanked. This is about preterm labor, but if you go into the post-date period, it depends on the state that you live in, but you're also going to need good dates for that too, because if you do have to do a transfer of care, then they're going to want good dates on you to do an induction or anything else necessary. So that's why we like to do the first trimester ultrasound. Some influences on people who may have preterm labor, like some reasons that someone might experience preterm labor: low BMI, so like a low weight when you're starting out in your pregnancy, stress, racism, smoking, drugs, if you've had a previous preterm labor, cervical surgeries. This is not an exhaustive list, but just some of the things. Any kind of infection, too much or too little amniotic fluid, multiples, if you have a short cervix. Those are all some of the reasons that could influence preterm labor. So moving along, prevention of preterm labor. One of the biggest things that we can do is minimize stress. Well, we can't take all stress away, obviously. Being an adult is stressful, but we can try to do what we can to minimize stress. So doing things such as like yoga and taking care of yourself, exercise, things like that, all things that can minimize your stress. Getting 500 to 1,000 milligrams of omega-3 fats per day, especially from like the second trimester on. Treating any UTIs, periodontal disease, which is in your mouth. So, getting those regular dentist visits in is really important when you're pregnant. I know for my own insurance, they actually do an extra cleaning while you're pregnant. So if you are pregnant, like, you might want to look into trying to see if your insurance will cover an extra dentist visit. And then also not being deficient in vitamin D, which almost all of us are. I live in the desert and it's 115 degrees outside. And you would think, well, the sun's blazing there, how can anybody be vitamin D deficient? Well, we're one of the most vitamin deficient areas because we avoid the sun. It's so hot you can't be outside when it's 115, at least not for a long periods of time. So if you are someone who has any of those factors that may play into risk factors for preterm labor, there are some things that you can do to help assist also. Like there's progesterone therapy, and then spacing out pregnancies. 18 months is ideal between pregnancies. Quitting smoking, making sure you're getting good prenatal care, getting the dentist visits in. And then another thing is, I know in our area, we are the only option for out-of-hospital birth. I'm the student midwife. I'm white. I'm cisgender. I don't have any of the major, I'm trying to think of the word, I'm not marginalized. And my preceptor is also white. And so there's not a lot of options here. So in order to come up with something that may help with preterm labor is finding a doula that is culturally matched. Whether that be a Black doula or someone who speaks Spanish. We have a lot of Spanish speakers here because we're right on the border. And thankfully we do have a doula that on staff that speaks fluent Spanish, and that stuff like that's helpful. So moving on, signs and symptoms of preterm labor. It's going to be a lot of the signs and symptoms that you're going to have if you're not having preterm labor. So cramps, diarrhea, lower back pain, pelvic pressure, vaginal bleeding, contractions that don't let up and, are pretty consistent. If you have a short cervix, in that second trimester ultrasound, they typically do measure your cervix length. So that can be a key factor. Any cervical dilation, which normally we don't do cervical checks, but if that was the case, if we suspected preterm labor, somebody might do a cervical exam to check. And then spontaneous rupture of membranes, obviously, like if your water broke and you're only 24 weeks, we're definitely going to want to get you into a hospital setting and do what we can for your baby. So those are some of the symptoms to look out for. And then some good resources. I know March of Dimes has some really good resources. Mayo Clinic has some good resources for preterm labor, symptoms, signs, risk, and what you can do. And then ACOG has some good frequently asked questions about preterm labor. All of those are some really good resources that you can read about preterm labor and try to minimize your risk.